Morning.
Good morning. Great. I am so excited about this panel and getting to spend a little bit of time with you both this morning. Thank you so much for joining us and being a part. So just a couple of quick introductions. I have the pleasure of speaking with Dr. Patton, who is the current System Chief Nursing Officer, for Swedish Medical Center, which is in a part of the Providence system. It's the largest hospital, in Washington. We actually go back pretty far. We've worked together when you were at UC Irvine, and you had a great success there, earned the fourth magnet designation, quite the accomplishment there. And before that, we're with Catholic Health Initiatives for quite some time, 16 years. So quite the career. Obviously very involved in the various nursing leadership organizations, AONL, the Northwest AONL chapter, American Nurses Association, and then you have the esteemed recognition of making Becker's 50 hospital and health system CNOs to know. Quite the accomplishment there for sure. So thank you, Dr. Patton, for joining us. And then, of course, excited to have Dr. Watkins join us as well, the current Chief Nursing Executive and Senior Vice President at UCI Health, and oversee all aspects of patient care and the nursing practice for the academic health system. And then you also are the Assistant Dean of Nursing Education, and we know how critically important that is for us to keep new nurses coming into practice. So we appreciate that. Prior to UCI, you were the Assistant Dean of Nursing Education at UC Irvine, Sue and Bill Gross School of Nursing. And prior to that, Chief Nursing Executive for Kaiser Permanente in the San Diego market. And I was one of the members while you were there and was in the hospital, unfortunately, but great patient care. So thank you very much for the services that you provided while I was there. So this topic, we're going to talk about, just the, the struggle often that folks have with taking care of themselves, right? With our busy schedules and whatnot. And so as leaders, you're a role model for others. And I would just like for us to be able to talk about how you incorporate wellness into your work week and into your organization, and really hear from you from, your personal experiences or whatnot. So with that, I'll start with kind of an opening question for you both. Can you share some of your personal wellness practices that help maintain both your physical and mental well-being?
Yeah, I can start if you like. And you hit on a very important point that it's really vital for us to walk the walk and talk the talk. Because if we're not doing that, our leaders, our teams don't see that and don't do that themselves. So the things that I focus on, I have a husky German Shepherd that I take on walks every day, and that's my time to check out. I have my granddaughter who just keeps me grounded, and I love reading. I'll share. There's a book that I just started that has really kind of opened my eyes. It's called Meditation for Mortals by Oliver Berkman. And every night you read a chapter, and it's really kind of helped me. It has a focus around we have finite time. We're not perfect. And it's just kind of reading it has resonated with me on how to reorient myself on what is possible and what's not.
I love that. Thanks for the book recommendation.
I love that, Anne-Marie. I'm gonna have to get that book because that sounds awesome. So I think, Kelly, to answer that question, I would say, I do a few things. One, I make sure that I try to go home when the day ends at 5 or 5:30 on purpose. Now, it doesn't mean I'm stopped working. It just means that I go home, right? Because my wellness is that I can go home and be in a place that I'm comfortable, right? To do what I need to do to continue the day, right? Even if I had to take my last call from home or finish emails or whatever it is. I think that's one, because we have to disconnect, right? If we're going to take care of ourselves, we have to disconnect in order for us to to do the wellness. I think the second thing for my personal wellness too is that I do some type of getaway every quarter. And I told my staff when I first started here at Swedish, and I told them at other places as well, that I take a time, whether it's a long weekend, whether it's a week, whether it's whatever it is, I take the time off in order to re-energize to do that. And my staff really didn't believe me because like nobody does that. And then I started doing it and they're like, wow. They actually said it to me a year later. Wow, you actually do that. And I said, yes, because I come back as a more energized leader in order to do that. And what that did to them, as Anne Marie said, is that we walk the walk. So it gave them permission. I had one leader tell me, I haven't taken a vacation in over a year. I said, why not? And they said, well, I never thought I could. And I said, why not? And they're like, because I just didn't think I could. So we get into our own heads, right, around self-care and wellness that we got to get out of. And so by me practicing that to show them that you can take the time off and it's okay, and you still get your work done and the place doesn't fall down, right? They started taking their time off and they're much better leaders, right? When they're coming back because they're more energized. So I would do that. And then try to get out and walk with my spouse, especially on the weekends. It's hard during the week, but on the weekends, get out, walk, get out in nature, try not to be stuffed up in the house. Try to stay off of email as much as possible because, we're all busy people, but try to do that to get, again, disconnect so that your mental wellness as well as your physical wellness really can be garnered. So
I think that is great. And I wrote that down, just being very purposeful about modeling that behavior that we need to as leaders. I think that's really great advice. And you answered the kind of the second part I was going to have is how you prioritize. And I think that just by scheduling it, and then also having the discipline, Anne Marie, with your dog and your nightly reading of the book, that really does help prioritize and model that for others. So kind of moving on into thinking about continuing the theme of incorporating wellness into leadership, Dr. Patton, what strategies have you implemented to promote a culture of wellness within your organization for your team to kind of follow that example? Oh, we lost your mic.
is it there? Is it not
Yes.
there?
Yep, we got you now.
Yeah, so I think I'll start with the time off aspect, and I not only encourage the directors and the managers, but I ask the managers, make sure your nurses, nursing assistants, HUCs get time off, right? To do that. Whatever you have to do to schedule through the time to do that and to purposely say, what are we doing? And try to make sure that they know that their vacations are approved ahead of time so that they're less anxious about whether I'm going to get that approved or not. That's a culture wellness. You got to set that culture right from the beginning and not like, have people come to you complain like I never get a vacation, my time always gets denied, whatever it is. Do that, number one. Number two, of creating, I love shared leadership and creating we call it shared leadership. That's because our group of nurses, that's what they want to call it. I know it's professional governance, shared governance, whatever you want to call it, but they want to call it shared leadership. So that's what we call it at Swedish. And in that space, we ask them, what do you want to do? How do you want to get things to do around wellness? And we did that as we started. A couple things came out. One was that they wanted wellness rooms, right? Or respite rooms to do that. And so we purposely created 3 different respite rooms around our system for them to do. And so I said, let's not just create a respite room. What do you want in it? So I don't want to just put things in it that I see in the literature or see at other organizations. What do you want to have in your respite room? And so they came up with that. Like one respite room has a big wall, like a coloring wall, and there's markers that they can just go color on the wall, right? Another one wanted an infuser, right? Where they would just come in and just sit there and, get some aromatherapy, right? To do that. So people just wanted a couch where they could just go lay down and take a 5-minute nap on their break, whatever it is, right? To promote that culture of wellness in their space. And then I think the last thing I would say around the culture of wellness is I'm trying, we're not quite there yet because of Seattle weather, but I'm trying to promote a culture of let's do walking meetings instead of Teams meetings. So let's get off of Teams and let's get out and walk around the block and have our meeting, especially if it's a one-on-one, right, to do that. So we're not quite there yet, but it's a work in progress of trying to create that culture of wellness.
You've got the summer months that are right around the corner, so you'll
Yes.
be able to incorporate the walking. I love that. That's a great idea. Great. So Dr. Watkins, talk about some of the strategies that you've implemented to promote the culture of wellness within your organization.
Yeah, and a lot of it is, as we've been chatting about, as nurses, we, just because of how we're trained and how we're oriented, we always put ourselves last. We don't take care of ourselves. We're terrible patients. We don't follow our own advice. So that's always at the outset, a challenge. And I know, in the pandemic, post-pandemic, a lot of us were trying to figure out ways, we're throwing all these things at our teams. Here's this, here's that, and you can call here and you can listen here. And it really, I know for me, it gave me pause because I saw, okay, no one's using these tools. And so it brought me back to start asking them, much like Pat was saying for the respite rooms, what do you need? What will help you? What will make it easier for you? Because, we instinctively want to help, but we have to really listen to what's meaningful for them. So some of that we've done is, if you kind of layer it, when we start with our new grad nurses, we set up mentor programs for them. So they have mentors not only through their program, but after, so that they can have that partner to talk about what it's like and how they can do some resolution to problems. We incorporate wellness into our new grad residencies, that it's just part of the curriculum is taking care of yourself. And then for our nurses, we have similarly, and I know Pat was involved when he was at UCI with designing our new hospital. We're opening up our new hospital in December, and we call them lavender rooms, but we have those on every floor for all staff. So it's built into the design. We're doing a lot of work around healthy work environments. We're doing a partnership with AACN and not only looking at the healthy work environment standards for our teams, but how does that impact patient outcomes? So we're looking at our trauma patient population and looking at for the ED, the critical care units and the step down units where those patients flow through. How are we incorporating those healthy work environments and how does that impact outcomes? And the main thing that those teams are focusing on is meaningful recognition. And what does that look like? Another thing that we started is something called decompression huddles towards the end of the shift. We're trying this in med-surg, and I got this idea from Jeff Doucette, is that the staff huddles, and it's like, okay, let's come together, let's do recognition, who needs help, anybody behind, and just kind of if there was any challenges during the day or during the night shift, they talk about it there and they kind of get it out of their systems rather than many times we'll just finish our shift and we take it home with us and we may or may not deal with it. And then we also have what we call integrative nursing, where we've incorporated practices such as aromatherapy, acupressure, mindfulness for care with our patients, but our staff use it themselves and have taken those practices on. And then lastly, for our nurse managers, we are doing the human-centered leadership program to really focus on that emotional intelligence and how we can be better leaders and more human-centered. We've looked at the span of accountability for our leaders and trying to deburden them from those administrative tasks, because the more bogged down they get, the more burnout, the less able to lead their teams they are. So those are just some of the handful of things that we've got in place, and those were all driven by what our teams told us and us helping to try to solve the problem that's at hand.
That's fantastic. So tell me how you've seen this personal wellness and how it's impacted the patient and performance outcomes.
Yeah, I mean, what is my organization? I've been there 2 years, and when I came into it, they were high performing. As and you were talking about Pat, the previous chief nurses have laid that groundwork. We got our 5th magnet designation, so it's a very yeah, thank you. It's a very highly engaged team. Very collaborative group. So a lot of it is just keeping the momentum going and keeping those wheels rolling.
Mhm.
Now, one of the challenges that we have is we have acquired 4 community hospitals in the last year, and we're kind of recreating the wheel, if you will, at those sites to get them to the same place. So the good part is we have a template, we have some ideas to do that, and they are really latching on to a lot of these things. And as we're improving and enhancing those programs, we're looking at it from a system lens.
Mhm. How about Dr. Patton? How about for your incorporating wellness and some of the outcomes that you've seen from a performance or patient care? We've lost your mic again.
Is it back yet?
It's
Can you hear
back.
me now? Okay,
Yeah,
I'm not sure what's going on, but sorry.
that's okay.
One of the things that we did this past year is I sat down and I took my patient experience committee through the book The Patient Comes Second. And I don't know if any of you have read that book, but The Patient Comes Second is a really powerful book that if you're going to have patient outcomes, you have to take care of your caregivers first. So the nurses at the bedside, the nursing assistants, our therapists, everybody who touches the patient, if you're not taking care of them first, then the patient will never get good outcomes and they won't get good experience. So when you focus on them and focus on and little things, right? And when I say little things, they're not little, like focus on their breaks, right? Does everybody get a break? And not have martyrs on your unit. Oh, I can't take a break. I can't get away. I can't. No, you can get away, right? And when people actually, you have them get away and take their break, they feel better, right? They come back and you know that they're going to improve in that space, right? I think again, I know Anne Marie does this well, and I try to do it well as like out there and do rounding, right? Get out there and see your people. And when you're on the units and you're talking to your staff, then patient outcomes kind of going to improve because they're giving you ideas, they're giving you questions, they're giving you thoughts about what they can do better and differently. Again, I go back to shared leadership, that it's so powerful because I'm like, okay, what are you doing in your shared leadership group to improve patient outcomes in your space, right? To do that. We celebrated a unit that had low length of stay because they came up with the idea that if they could put an admit discharge nurse there on high surgery days, they could get people out, which improved their patient outcomes, but also improved the patient experience because now that patient's going home at 10, 11 o'clock in the morning instead of like 4 o'clock in the afternoon, right? To do those types of things because they incorporated that in the way that they're doing things on their unit, right? One of one, but it still works on how you create those. So I think there are many different strategies and aspects you can use, but I think we have to concentrate on our caregivers first so that patient experience improves.
I definitely have heard that we focus on employees first, so nurses first, your caregivers. That totally resonates and makes a lot of sense. Any other like success stories you want to share that, that wellness led to a great outcome or good patient experience or feedback from the patients?
Yeah, we have a great patient family advisory council at Swedish, and having patients come and talk. Can you hear me now? Is it back? Is it working now? Can you hear me?
Now it's good. Yep.
Okay, sorry. We were saying we have a great patient advisory council at Swedish, and talking about those things. And we have one patient who sits on the patient family advisory council because you talked about a success story and a patient story that he had a kidney transplant, and he was talking about how he was a runner, and then how he spoke to a couple of his nurses who were also runners. And what that did was it helped like the wellness aspect. He was like, I really want to get back out running again. And they're like, yes, you could do it. And here's how much I ran this past weekend. And he shared the story about how that helped him get through his hospital stay because he talked about his running and they talked about their running. So, and you go, I think that encouraged the nurses, right? That the things that they do in their off time, they can share with their patients to identify, right? Connect with their patients in a way that's going to help them do things. So that was a strong story that we heard recently.
That's great. Dr.
Hey,
Watkins,
Kelly.
any success stories you'd like to share?
Hey, Kelly, I just want to interrupt for 1 minute just to give a 10-minute warning, just the 10 minute that there's 10 minutes left in the presentation, just so everybody knows. Thank you.
Great. Thanks, Beth.
You. I would just share, another perspective. We, as many of you are also experiencing, we've been running at 102% capacity for quite a while. And so we recently had to convert some of our larger single rooms into double rooms, which is not a patient satisfier. And so we were fully expecting that our patient experience scores would drop. These patients are not going to be happy about being in this crowded room. And we actually have not seen that. We have seen those scores remain steady. We've done a lot of work with rounding on those patients and working with our teams to, before you go in the room, you put on that, you narrate the care, you reset yourself because we know the working condition is not ideal. And so that is kind of evidence to me as Pat was saying, is that if our teams are getting their needs met and they are satisfied and engaged, we can make the best of any situation so that our patients still feel they're getting quality care. It's a good experience in spite of all the other noise that's going on.
That's wonderful. Thank you. I'm going to, the next one I would like for both of you to address as well. And this is really thinking about advice for other leaders that are looking to incorporate wellness into their organizations. Advice on how to go about doing this if it's not already a part of the culture.
And say that one more time.
Looking for looking for your advice for other leaders who want to incorporate wellness into their organizations.
I think that, they had, like Anne-Marie and I have been talking about the strategies that we've been doing and using because we're both dedicated, I think, to that space. I think they have to be dedicated to listen to their staff. And I think, as we both said, find out what they want and what they need. Don't try to take something and fit a square peg into a round hole. Get to what they need, because that's only going to then do things best for them, not for you, right? You could go do and tout that, hey, I'm going to do this, but why would you do that? Why wouldn't you listen to what they're doing? Because you could create respite rooms all over, but if nobody's going to go in and use them, you've spent a lot of money for nothing, right, to do that. So how can you do that? I think also, I like Anne-Marie's debrief after shifts. I love that idea. I'm going to steal that and take it back. And I think, she also talked about her lavender rooms that they're going to have on every floor. I think making sure that you incorporate things that maybe people don't know about, right? Like code lavenders, right? Tea for the soul, critical incident debrief sessions. Because even though people are like, oh, I don't want to do that, I don't need to talk, I can tell you many, many times after I've either been in those sessions or heard debriefs after those sessions that the caregivers they just felt much better because they had a place to talk. They had a place to do. So make sure that you're listening, number one, but also make sure that you're providing things that allow people to decompress in whatever way that is, whether it's shifts, whether it's after an incident, whether it's after a death, to do that, and to focus on our new grads, because when they have their first death, sometimes it's traumatizing. And so you need to spend time with them to really listen to them. And a lot of times our preceptors do that. We'll take them in, just sit down with them in the break room, have a discussion with them, but then to always follow up with them. How's it going? How are you feeling? Right? To make sure that you're doing that and promoting those spaces. So that's what I would say.
Dr. Watkins, anything to layer in?
Yeah, I think the other part of it is a lot of this can be overwhelming. And many of these programs that we've talked about, we've built over time. So I think you start small, you identify an area, again, listening to your teams. It might be mental health, it might be physical activity, it might be anything. You do a small pilot, just a one patient, one nurse at a time, and see how that works, get that feedback, and then adapt as needed to make that successful. And then that consistent communication. If it's something that's successful and you want to spread, what works in one department may not work in another one. And how can we adapt that so that it's meaningful to everyone? And then we, can't overemphasize enough is really keeping ourselves focused and setting that example, because it's easy to slip and appear overwhelmed and not balanced. And then your team is saying, well, my boss is here 24/7. I need to be here 24/7. And that's not realistic. So I think that cannot be overemphasized.
I think that's great. And I want to go back to kind of our beginning comments about just modeling the behavior and the expectations for our team members. I think that's just incredibly important, and taking the time to take care of yourselves so your teams are taking care of themselves as well. So thinking about the long term, how do we make sure that organizations incorporate this, as not a one and done, checking the box? We've now implemented a wellness program, but really, like, how do you sustain it for a long-term success? We lost your mic again. There
You
we
talked
go.
about this morning about as you started us off with our session around culture, right? And if you don't build it into culture, it's not going to sustain, right? And the only way that you can build it into culture is to have people from the ground level help lead it and help support it and help mold it, right? To do that, because we as leaders need to be able to remove barriers and provide guidance, but we need to have it done from the ground, the grassroots, right? That are getting done. So I think that's the way that you can sustain it. At least that's how I've seen in my career that I've seen it sustained, is when somebody that owns it from the ground level, they will keep it going because they will see it and their colleagues will identify with them so that they can see that it's going to continue on as well.
Dr. Watkins?
Yeah, to build on that, it's not an add-on. It's not something just to live in its own little silo, much like we've all done with our diversity, equity, inclusion, and belonging initiatives. It's a lens, and everything we do should be viewed through that, what's going to make sense. And then things are going to change over time. You may implement something and you don't need that anymore. And you have to be able to adapt to that and not just hold on to that. And I think any opportunity that you have to redesign work areas or practices, workflows, take advantage of that and see what others are doing. And don't just presume that we have to do it the way we've always had it, and we have to design it the way we've always done it. So our practice is evolving and our workloads are changing, and we have to make sure we account for that.
I think that is great advice from both of you. I appreciate that. The other thing that I heard is that there is some financial investment, obviously, in wellness programs and, the spaces, the respite rooms and whatnot, but there's a lot of low cost, no cost pieces that can be incorporated that are very impactful. So you can start small, building a culture of wellness to take care of individuals with not a significant investment necessarily in dollars, but it is an investment and a meaningful one of time and just needs to be incorporated. We are just about at time, so I just wanted to thank you both so much. I wrote down a lot of notes, and I hope our attendees did as well. It's been a great session, and I appreciate you both so much. It's great to see you again, and I hope your wellness journey continues very well, and those great outcomes. Look forward to seeing you again.
Thank you for the